Mrs.R.Meenakshi. I am an Assistant Professor of Economics, Nirmala College for Women. In this video, we are going to learn some basic concepts of health economics. Health economics as a subject, it is evolving very recently. Health economics is an important branch of economics which deals with production of healthcare and consumption of healthcare services. The students who are from economics and non-economic students can understand the basic concepts of health economics.
Learning objective. Students can apply the key concepts of health economics. Before entering into the health economics, first we have to know about what is economics. Economics we study primarily when we have limited resources and unlimited demand. I mean, we have enormous demand in our life, but we have limited resources. I want to live 100 years, but I have limited resources in terms to be it pollution, be it availability of doctors, food habitat, and so on. Economics is about choices. I can choose good A or a good B. It depends on my budget constraint. Choices may differ on time constraint, taste constraint, and so on. It is based on the individual. Let us know about definition of health. According to World Health Organization, health is state of complete physical, mental, and social well-being. Is healthcare is a commodity? Yes, health is a commodity. Just like any other commodity traded in the market, and the utilization of quality of healthcare services has become a serious problem, both for the vulnerable sections of the society and the general population. Now, when we talk about health economics is a branch of economics. It deals with production of health and consumption of healthcare services. While talking about health economics, we will primarily deal with microeconomics, where dealing between the healthcare proprietors and the consumers, which are basically the patients or individuals or a household. But at the same time, macroeconomics also has a significant importance when it comes to the government. Economist Kenneth Arrow is the father of health economics. He is often credited with giving rise to health economics as a discipline. Structure of health economics is neatly encapsulated by Alan Williams, a British economist, by using plumbing diagram. He divided the health economics discipline into topics. While first concept is what influences health, that is, other than healthcare, genetics, occupational hazard, consumption pattern, education, income, and family background. These are the influencing factors of healthcare. Concept is what is health and what is its value. Health contains the conceptual foundation. It contains a multidisciplinary literature in which one finds economists, epidemiologists, operation research, psychologists, and sociologists, all working and sometimes even working together. The demand of healthcare. The demand is derived from the demand for health, and it comes logically after the and determinants of health. Some of the basic health concepts are health status, health seeking behavior, choice, and system of medicine. Health status. Self-assessed health status. It's measured by 5 points, that is, very good, good, normal, bad, and very bad. Health seeking behavior, that is, if are you sick, yes or no. If yes, health seeking behavior is started. For example, I am having a fever, whether I go for the hospital or not. If I am having the habit of going for the hospital, there will be a treatment seeking behavior. Here, demand for health arises. When demand arises, choices arises. In terms of choice of hospital and system of medicine is chosen by individual according to the budget constraint. On supply of healthcare, it deals with cost of production, alternative production techniques, input, market for inputs. At the same time, the healthcare industry encompasses not only for the more obvious healthcare organizations like hospitals, general practices, and the medical supply sectors, but also other public and private caring agencies. Structure is market analysis. The ways in which markets in all these sectors operate and is a major chunk of applied health economics, especially in the countries where there is a substantial dependence on market institution for the provision of healthcare insurance and the delivery of healthcare. Next is macroeconomic appraisal. As a healthcare industry is getting more and more important because during last few decades of achievement in science and largely in technology, and as well as awareness level among the consumers have also been increasing over the period of time. And with a large improvement in healthcare technology, the people got different choices. Here, as a macroeconomic appraisal, is measuring on the basis of cost effectiveness, cost benefit, and cost utility analysis. Concept is planning, budgeting, and monitoring mechanism. It's a significant importance when it comes to the government. For example, now rapid spread of coronavirus affects the people, while the government will think of what particular aspect of healthcare should be provided, how the particular immunization should be provided, whether to be a free or in which aspect privatization should be invited. And finally, evaluation at whole system level. It consists of equity and allocative efficiency criteria brought to bear on market analysis and macroeconomic appraisal, inter-religion and international comparison of performance and financing method. These are some of the references.
I hope this video will help you to learn some basic concepts of health economics. Thanks for watching.